For this training, we're going to go over the initial infection report and the daily infection monitoring. So what happens is anytime somebody has an infection and we order antibiotics, like we did in a previous video, so this order is now active today, what's going to happen is we then need to do 2 different assessments for this resident. The first one happens one time. It's the initial infection report. Let's say it developed in-house. Save. The second assessment that we need to do, that is an ongoing assessment while they're on antibiotics, is called the infection antibiotic daily monitoring. So you'll come here, depending if it's day shift or night shift, you'll select that. In this case, I'm doing this in the night, so we'll choose night shift, save. Okay, so let's start with the initial infection. We will come here to details of the infection. So it is up to, let me get back. So when you start the antibiotic, it's up to you to do these first 2 bars. Obviously, the resolution hasn't happened yet. So you'll come here to the details of the infection and just start going through this assessment. Based on your answers, it will open up more of the assessment. So let's pretend this infection developed in-house. So this just depends. This will be customized to your different buildings. Mountain View room numbers, we'll just say they're in room 20. Okay, so symptoms started yesterday. That's when we got the lab results, or we did the labs yesterday, got results today, started antibiotics today. So we'll say it is a UTI. So then it will pop up and ask you, did they meet McGear's criteria? The cool thing about this is you must select 3 to meet McGear's criteria. So it tells you what McGear's criteria is. If you come to the skin and wound, it'll then change and say you have to have 4. It'll then ask you the site. Eye only has to have 1. So very helpful that way. So urinary, no catheter. You can come to So that's very helpful to help you understand McGear's criteria to make sure that you're ordering antibiotics appropriately. So we'll go to urinary tract infection. Let's say, yes, they have fever, there's some burning, and there's a change in mental status. So 1, 2, 3, we've got our 3. Then we'll update our care plan. So they have a UTI. The goals are that it will resolve. We have antibiotic therapy. Let's give antipyretics and analgesics as needed. Save and next. I'll show you a trick with this real quick. And then, so you see that I didn't sign it. I just did save and next. I'll show you in the next little bit why I did that. Practitioner notified, yes. So we talked to our doctor, notified them today. We'll say it was at noon. Yes, I contacted the resident representative. Let's pretend it's Connie in this case. Came here contacted them at 10. Resident is not on hospice in this case. Labs were ordered. We got our labs today. Lab results, let's just say white blood WC at 20, we'll say. So pretty high. Diagnostics ordered, no. Let's pretend we ordered a culture. I don't know. Why not? Why didn't we do a UA? We did a UA and we found E. coli. Great. So we also got the UA today. Culture, you can choose all of these. Great, we got E. coli. Let's just say, depending on what you have here, that is your precautions that you'll use. Yes, treatment was started. Yes, it meets McGear's criteria. It'll show you the allergies. Just make sure you check that you're not giving something they're allergic to. If you say no, it did not meet McGear's criteria, come here and you have to choose why. You have to kind of explain why you're still treating even though it didn't meet McGear's criteria. Medication 1, we'll scroll down here. Oh, so in this case, the reason they're not here is because this resident doesn't actually have a bed. These medications are not officially active, but normally what would happen is the medications would pop up here. You would click the medication, it would pop up in this section. You'll choose the start date, the stop date, and then your provider. Okay, there you go. So then you can do save and exit. Now what you notice is both of these will be yellow, and now you can click sign all. It's really helpful. It'll just help you sign both of them at the same time, so you don't have to go through each of them. Saves a little bit of time when you're in a crunch. There you go. Pretty handy. Go back there. So now you're done with the initial infection report. What will happen is your infection preventionist will then come along to the resolution and fill out that part. Then you have the daily monitoring. This is done every single shift for the duration of the antibiotic plus 3 days after they've completed the antibiotic. And all it's doing, this is probably the quickest assessment you've got here. It's just asking, were there any changes and what are we doing? So type of infection, urinary, no catheter. The vitals will automatically update. The allergies will update. The medication, same thing as before. It'll show up here. You select that. It'll fill all that in right there. Other therapies and treatments. I mean, you can choose that. We can say pushing fluids. So there we go. And we can also say there. So any symptoms of the UTI, are they still having anything? So let's say, yeah, their mental status is actually getting worse. They still have a temperature. So we can say here, APAP given, monitoring. Oh, there. New or increasing continence. Maybe we had to put a brief on. Okay. So, and then any adverse drug reactions here. So if they are itching, if they're having sort of anything here, it'll pop up and ask us, did we notify the physician? If they're having nausea, if they're vomiting, any of those things. So let's say our dude is totally great, none noted. So here we go, save, sign, lock, and exit. And we are golden for that one. So it's a pretty quick assessment, especially when you start like copying forward. So let's pretend I'm on the day shift. So I'll copy this. Come here, vitals will update as long as you've input your vitals. Medication, you will have to select this one still. You'll click there and then it'll come here. Let's say, actually, no, mental status is not worsening. That's great. We're still monitoring level of consciousness. Let's just put here, Tylenol's been given and he's still on briefs. So, and then none noted. So let's come here, save, so we can get rid of all these check marks. In this case, it probably would just be faster to select those. But in this case, I'm just going to show you here, check all. This will select all those check marks, save, acknowledge warnings. They will all go away. Then you can come save, sign, lock, and exit. And you are golden. There you go. That's what you have to do for infection. Now, if you're the first one to do an infection report because you started the antibiotics, you should also probably just make a progress note about what happened there. So let's say here, nursing progress note. So CBC and UA drawn and resulted today. MD notified, gave orders for Bactrim and I'll just say Bactrim. Family notified, all questions answered. Okay, there we go. That's about all you have to do for that. We'll save that. You just want to make sure you've got good stewardship so you can show people what you've been doing. The orders are in, the assessments are in, and that is your infection charting.